So, first of all, Sister Aisha, can you tell us a bit about the introduction about Amani natural birth, its role in the medical field, and is it completely different entity, or is it part of a medical practice?
Okay, thank you. Assalamu alaikum, bismillah. I'd like to start out, I'll introduce to you a little bit of what Amani birth is all about. So Amani birth is a philosophy for educating women about the way that their body works during the natural process of pregnancy, labor, birth, breastfeeding. It's really founded on Islamic principles and a belief that Allah is the creator of all things and that our bodies are made to give birth in a very natural way. Now, having said that, what we really want is for women to learn to work with their body during labor, to seek education, to ask questions. When we are in a medical setting, which most women would be if they were in Malaysia, we were looking for women to look at what are the benefits of things that we want to do during labor, what are the risks of anything we want to do in labor, are there any alternatives, give her a moment to make istiqada, and then think about what if I don't do anything, what if I wait. So it's really about using her brain. Benefits, risks, alternatives, istiqada, and what if I do nothing? So what you want women to do is you want them to have discussions, you want them to have enough information to make informed consent about the things that they do or do not want in a medicalized birth setting, which I would expect that most women in Malaysia will be in a medicalized birth setting. So the role of the medical field is really to be observers and lifeguards in case there's any complications, because we know that although most births go really well, there are births that don't go so well and they have complications, so we need medical observation in case of a birth that goes into a complication, because when birth changes into a situation that needs medical attention, it can change, and it can change really quick. So the role of the medical field is to be there to support her. And I think one of the hardest things about birth from a medical perspective for a woman who wants to have a completely natural birth is waiting and not doing anything unless there's an indication to do so. So what we really want from a perspective of women who want to have a natural birth is we want a patient and secure lifeguard on hand who doesn't intervene unless there's an indication or a need to intervene. So the medical role obviously is one of observer and of rescuer in case something does go wrong. And you asked if it's a different entity or a part of the medical practice, Amani. Amani is not part of the medical practice because it's not a medical program. We're not doing anything clinical. Anyone who's involved with Amani should not be doing heart tones, they shouldn't be doing blood pressure, they shouldn't be doing vaginal exams, they shouldn't be doing anything except loving and encouraging women through birth. And we're talking about doulas who might attend a birth. So you have the education piece where we're teaching mothers and empowering them to find out how their body works and to work with their doctors. And then you have the doula piece where they're attending births with the mothers, and those doulas are there just to encourage them through the birth, to help the husband, obviously, who's hopefully there at the birth also, to support his wife through the birth. So they're there to enhance the couple's experience, not to be a part of the medical team. They're not medical. They don't have medical training. And if they want medical training, they need to go to school and have medical training. This is not about medical indications or medical interference by any means. Okay.
With that said, can you tell us the main role of an OBGYN in the process of having a natural birth, and how can an OBGYN practice its natural birth techniques in a hospital, which is surrounded with by modern medicine practicing doctors?
A natural birth can happen anywhere. It doesn't have to be in any particular setting or environment. It's nice if it's a homey environment, where you have a normal bed and you have, soft lighting and all of this. But a natural birth can happen anywhere in the world, in any setting in the world. I've had many babies myself in a very clinical setting, but still had a natural birth. When we talk about a natural birth, we mean one that is minimally medicalized. So usually the women are not taking pain medication. Usually there's not a lot of medical interventions. But then if they're necessary, if medical interventions are necessary, she needs to be flexible, of course. You don't want to be stubborn to the point that you end up with problems because you're, so strong-headed towards a natural birth. But if everything's working well, the OBGYN's main role is to be there as a patient observer and ready and observant for any kind of complications, but for the most part, just kind of letting her get on with it, letting her give her birth. There's not much to do. When birth goes well, there's not much really for anyone to do. It's when there's a problem that you need to have someone on hand who's ready and knows how to handle the problems. So, which is rare, really. The majority of births go just fine. So.
Alright. So next is, can you tell us what is a doula and what are their roles?
Okay, so a doula's role is to be there to support the woman educationally and emotionally. Like I said a few minutes ago, she's not there to do anything medical. I often tell my doulas, you're there to love the woman through her birth. Birth is driven by the hormone of oxytocin. So we want the woman to be in an environment where she feels loved, where she feels safe, where she feels secure. And oxytocin comes from a bond that happens between the mother and whoever's in attendance, whether that be a doctor, a midwife, a doula, her husband, her sister, whoever's there. And their role is just to keep that loving encouragement. So when women start to get to that point where they don't think they can do it anymore, it's looking in their eye and saying, sweetheart, you're almost done. You can do this. Let's just do one more contraction together. Do you need to go to the bathroom? Can I get you a drink of water? The word doula actually means slave. That's what the word means. It's a Greek word. And it's about just doing whatever the mom needs to help support her through her birth.
So what are the differences between a doula and a midwife?
Oh, they're nowhere near the same. A doula and a midwife are nowhere near the same. A midwife is a very clinical practitioner. A midwife is just like an OBGYN without the scalpel. So a midwife pays attention to all of the vital signs. They pay attention to the baby's fetal heart rate. They're watching the mother's blood loss after the birth. A midwife is a clinical professional who's doing her charting, who's, really taking care of the whole clinical picture of birth. As a midwife myself, I love when doulas are in attendance because the doula doesn't have to worry about any of that. The doula's role is not to worry about any of that, but to be present with the mom. So while I'm looking at blood loss and vital signs and is the baby breathing, the doula's focus on the mom and how the mom's doing emotionally. So the doula's role is more of one emotional and educational support, and the midwife's role is one of being that lifesaver in case of complications. And a doula is not, by any means or any stretch of the imagination, a mini midwife. You cannot attend a birth and expect to respond in an emergency if you don't have training. And not only do you need training, you need to have supplies and equipment in case of the need for interventions. And if you look at midwifery births, where midwives are in charge of births in countries such as the UK or the US or the Netherlands or Australia or New Zealand, where midwives attend home births, they come with a full kit with them. They have oxygen, they have Pitocin, they have IV lines, they have all of the tools necessary to suture and take care of the mom and the baby, to resuscitate a baby. They bring all that with them. Everything up to the OR, they have it right there with them when they come to the woman's home. That's a midwife. And that can happen in a hospital setting, of course, where she has all of her stuff, or it can happen in a home setting if you're in a country that has logistics for home births, like I said, the UK and countries like this. A doula should be attending side by side with that midwife with the purpose of supporting the mother emotionally and educationally, but not clinically.
If the mother has a very low risk of complications and she feels that she can do it, she can do a natural birth, and is it enough to just have the mother and a doula?
Absolutely. Never. A doula is never a lifeline support, ever. Now, there are mothers, and you have issues in Malaysia of mothers that are choosing unassisted home births, and they're doing births at home. That's a choice that they're making. Whether a doula is present or not is irrelevant. A doula is not there to save the mother's life, and she should know that, and the doula should be very clear about that. I don't like doulas attending home births because I think the mothers can get confused and think they have a mini midwife with them when they don't. But if the mother understands that this is not a mini midwife and not someone who can save my life, and she still chooses to have an unassisted home birth, I mean, unless there's a law against it, you're not going to see that trend stop. You've had unassisted home births growing on the rise in Malaysia long before Amani birth was even in my mind, before I ever wrote the name Amani. You've had this systemic issue going on, and the problem that you have is not just that they're having unassisted home births and there's a community of women encouraging each other to have unassisted home births. That has nothing to do with Amani. Your bigger issue than that is a lot of these women are not low-risk women, they're high-risk women. And part of the reasons that they're choosing to have unassisted home births is because they're not getting support in a hospital setting to have anything but a repeat cesarean and a repeat cesarean, and they don't want a repeat cesarean. and no one's giving them the option of anything else. So they either go under the knife again, or they take matters into their own hands. There's got to be a middle ground for these girls. If we don't find a way to give them a middle ground, they're going to continue to have unassisted births. Most of them will go just fine, because most births do go fine. But you're going to have one here and there that are going to flip and they're going to turn deadly. And we've seen that in Malaysia. And yet, it's going to continue happening unless we give them some alternative options.
So now, how can we break the barriers between a pro-natural birth doctor and a modern medicine practicing doctor, and as well as to break the barriers between doctors and midwives?
Okay, so you're talking about two different perspectives of care. So if you're talking about a pro-natural doctor or a pro-natural midwife, for example, if you have midwifery care, versus a doctor who's very reliant on medical interventions, the first thing you have to understand is this is a difference in perspective, okay? One that believes that women have a right to give birth naturally if they want to, and we shouldn't be intervening unless there's a reason, and one that believes that every single birth has to be intervened. We've got to come to a middle ground here, and the bottom line, I think, comes to respecting the patient. It's about informed consent and patients' rights. My perspective is that no medical person has a right to do anything to me while I'm going through my birth, which is a natural life event, unless I've given express consent. You don't touch me, you don't cut me, you don't inject me, you do nothing to me without discussing it with me first. That doesn't mean I'm going to refuse everything you want to do, but we should have a conversation about it. I should understand what are the benefits, what are the risks, what are the alternatives. Again, use your brain. Let me pray istikharah if this is something major, and what if we do nothing? What would happen, Doctora, if I didn't choose to follow your advice? We should have that conversation. And if you've got a good relationship between your patient and your doctor, where a doctor's giving true informed consent and telling the patients the benefits and the risks and allowing the patients to make their own decisions, most patients will follow their doctor's suggestions. And that's what we have to think of it as. Doctors give us suggestions based on their clinical experience of what they feel would be of best benefit to us. As the mother, though, I'm the one that lives with the consequences. So I'm the one that should decide. Now, this is barring a medical emergency. If we're not having a medical emergency, you don't have a right to touch my body without my permission. I want to know what's going on. I want to know, do I have any alternatives? And then I'll make a decision for myself. And then the doctor should be one who's willing to support whatever my decision is, one way or another, whether it goes along with the doctor's, instincts and how they want to act or not, or whether they go to, some other alternative that the mother wants to do. That's entirely up to the mother. The doctor may like to deliver in lithotomy. I don't want to deliver in lithotomy. Is this a matter of life and death? Is the mother or baby going to die if I don't put her in lithotomy? No. Then why put her in lithotomy? The mother doesn't want pain medication. I want to give her pain medication. I want to put her out of her misery. I want to have a mercy on her, and I don't want her to feel all the pain. Is this a matter of life and death? No. I want to give her an IV. You know what, if she's well hydrated and she's drinking and she's, keeping herself, energized, there's really no reason to give her an IV. Now, I understand in a medical setting, sometimes we're like, oh, but if we don't have an IV and there's an emergency, it's hard to get an IV in. Okay, give her an IV, give her the catheter, cap it off. You don't have to have it connected to anything. If an emergency arises, you've got a line to the vein that you can quickly access if the emergency arises. I'll guarantee you, though, in most cases, you're not going to need it. In most cases, because birth goes just fine. So it's about giving the woman informed consent and then respecting her wishes as to how she wants to handle her birth. And if something goes wrong, you've got a baby not breathing, you've got a woman who's bleeding, or she's got a retained placenta, absolutely, you intervene. And if the mother's conscious enough and it's not urgent enough, you still explain to her what you're doing and why you're doing it, or what you want to do and why you're doing it. If it's absolutely like, this woman's going to die if I don't do something, you just take over her body. Absolutely. You take over and do what you have to do. But you don't do that if it's not an emergency. And I think that's where the issue is coming up, is the women in Malaysia are looking for more respectful care, to where they have options to make decisions for themselves. Let me weigh the risks and the benefits. Let me decide what risks I want to take. What do I think is a better choice? And then supporting her in that choice. VBAC is a huge issue in your country. The primary cesarean rate is too high. When you have a too high primary cesarean rate, then you have women who are seeking VBACs, and if they're not able to get a VBAC, then they're seeking, where can I get care elsewhere? I can't get care anywhere, so let me just do it at home. So this is the problem that we're having.
So, as the conflict now in Malaysia is always between the doctors and the doulas or the midwives who are practicing natural birth, how do you think the best way to create a harmonious relationship to these two so that both can come to a mutual respect and have each other?
Well, it saddens me that there's any conflict at all, because first of all, a doula should never speak for a client. So a doula is not an advocate for a client. Okay? The woman is the only one that can speak for herself. A doula can support her in her wishes, whatever that might be, but she's never to speak for the client, so she shouldn't be in conflict with the doctors. If there's any conflict, that would be between the mother and the doctor herself. The doula has no right to speak up on behalf of any client in any situation. So there shouldn't even be a conflict. And the real issue here is we all want the same thing. We want a healthy mom and a healthy baby. There's no one in their right mind who's serving women and babies in any capacity that doesn't want a healthy mother and a healthy baby at the end of it. The problem is the journey to get there sometimes can be a struggle between what one model of care wants to provide and what the mother wants. So, and the mother has to be realistic too. What are my risk factors? What is my health status and situation? You know, if I've got a mom with a really low iron count, I'm going to be more concerned about her having a postpartum hemorrhage, and I'm going to be watching her more closely if I were a midwife, for example, not a doula, because that's not a doula's role. And then if I have a woman that's going in there with, high iron numbers, you're going to have different concerns for different women based on their health situation, and doctors need to be honest with women. Women are smart. Talk to them. Tell them, this is your health situation, these are the concerns I have, and this is why I have the concerns. This is my assessment of risk. This is what I think we should do. And the mom could say, what are my alternatives? Well, the alternatives are whatever they are, and then let the mom, decide on the other side of that. Okay.
And this is a repetitive question. What is your opinion on home birth? And is it necessary for people to encourage home birthing? If yes, why? And what are the advantages and what are the drawbacks of having a...
Okay, so on the topic of home birth is a very personal decision that a woman may come to. First of all, she has to look at, does my environment support home birth? In the UK, every woman has a right to a home birth. Okay? In the United States, some states allow home births, some states don't. In Malaysia, you don't have, to my knowledge, any medical support for home births, or if you do, I'm not aware of it. So a woman in Malaysia who's choosing a home birth most likely is choosing unassisted home birth. If she wants to take that choice, I'm not here to stop her, but I really, really want her to understand that she's taking a risk and that she doesn't have any medical backup if she's doing that, because you're not providing any kind of medical backup. I don't think anybody should be encouraging anybody to give birth anywhere. I think it should be the woman's choice, where she gives birth, who she gives birth with. Those are all very individual and intimate decisions. I do think that women need to shop around and find the best care provider to support themselves. I think sometimes we spend more time shopping for our hijab than we spend shopping for a doctor. But if you look in the Imani materials, left and right, you'll see, shop around, find the best doctor. Look for the doctor who you feel is going to be most supportive. Interview your doctor. Ask your doctor questions. You don't just go to the one next door to you because they're next door to you. You don't just go to the one your insurance covers because your insurance covers them. If they're not going to support what you want, look around. Is there somebody else? Could you save up the money to go to another country if you wanted to? Go to UK and have a birth if that's what you want to do. That may not be realistic for everyone, of course. But the reality is women do have choices, and they need to look around and see what those choices are. And you have some excellent doctors in Malaysia who are really supportive of natural birth. They're there. I know they're there. And so it's a matter of the women seeking them out, and then if they don't have the means to pay for it, finding a way to pay for it. Because I guarantee you, if your baby was really sick and needed medical care that was outside your scope of being able to pay for it, you would find a way to pay for it. Your birth should be just as important. You find a way to pay for the care that you want. So.
And lastly, about Lotus birth.
Okay.
What is it? Should such practices be encouraged? And what from where this Lotus birth idea come from, and what are the benefits of having a Lotus
Okay, so Lotus birth is where the baby's born and we never cut the umbilical cord, and the mama carries the baby around with the the placenta and umbilical unit intact, and it usually falls off nice and clean in about 3 days. So it's a quicker release of the cord than if you leave the stump on. It takes about 12 to 14 days. Okay. What are the benefits of a Lotus birth? To be frank with you, I think it's a little extreme. I don't think it's really necessary. I think it's nice to wait until the cord stops pulsing or the placenta is born before we cut and clamp the cord. Okay, I don't think that it needs to be done immediately when the baby's born, and in fact there's studies and a lot of research to show that we're actually harming babies when we immediately cut the cord. We're making anemic babies, we're making resuscitation of babies who aren't breathing much more difficult when we cut the cord immediately. So there's a lot of benefits to keeping the cord intact. Once the cord stops pulsing, and definitely once the placenta is born, I'm fairly confident to say that the baby's probably done using the placenta. To me, it's very inconvenient to carry a baby and a placenta around. However, as a midwife, if I were delivering a baby, whatever setting that might be, it would have to be a legal setting because I wouldn't do it in this country that doesn't allow me to practice. But if I was delivering a baby in a legal setting and a mom wants a Lotus birth, I don't have a problem with it if she wants it. I wouldn't want it for my own child just because it's inconvenient to carry around a baby in a placenta. I got places to go and things to do, so I don't want to carry that, unit around. But if she wants it, there's no harm in it. It doesn't cause any harm. And you ask me, where does it come from? I have no idea. I don't know where it came from. I know that they do it a lot in Indonesia. I know Robin Lim practices Lotus birth with some of her clients, and I've done work in birth centers where moms want to keep the placenta attached. We keep the placenta attached in the birth center I work in, or did work in for my clinical practice in Indonesia for 12 hours because we don't have cord clamps. So we don't cut the cord until the cord's dry enough to cut it without a clamp. So we cut it at 12 hours and send the mom home. Some of those moms choose to have the cord and have the placenta stay on and go home with it if they want that. I mean, that's up to them. But I don't think there's any reason to encourage it one way or another, So I don't really, and I don't have any clue where the practice came from. I would imagine some indigenous practice somewhere, but I have no idea. So.
All right. So lastly, your hope and a take-home message for everyone listening.
Okay, so if I'm talking about Malaysia, my hope for Malaysia really is to be able to look at the systemic issues that are driving the increase of unassisted home births, because this is your issue. Your issue is unassisted home births. So we need to look at, and maybe even do a research study of women who have chosen that route or even considered that route and find out what are the underlying reasons why you're choosing an unassisted home birth. What are those? Can we address those issues in the system? Because these women are opting out of your system. Why are they opting out of your system? So my hope would be that we take some serious time to sit down with those women and not just hear what they have to say, but do something about whatever it is that they have to say. And I can only speculate the reasons why women make decisions to have unassisted home births. I mean, I don't live there, and it's not my country. I can't speak to that. But I know that these women are crying out. They're not getting the support that they want. And it's not that hard to support them in what they want. It's a matter of respecting their wishes and not taking over their body and not doing things to them that they don't want to have done. Again, unless it's an emergency. If it's an emergency, all bets are off. But as long as it's not an emergency situation, it's about respecting mothers and their wishes. That's what it boils down to. So my hope would be that we come to a place where women have options for respectful care and don't feel like they have to opt out of the system to get the birth that they want.